Hey everybody. So there's a couple of things that just don't add up to me right now, and I wanted to lay them out in order so that you can kind of follow the sequence with me mentally. It's been a couple of months back when we were exposed to information that we have a novel virus, and the choices made at that time, although uncomfortable, were reasonable given the situation, because there was a lot of unknown data at that time that needed to be acquired. So potentially putting a mask on, sheltering in place, social distancing, changing our lifestyle in a way that basically isolated us until we could gather data was a reasonable request for the stated intent. And the stated intent at that time was to change the rate of infection, not to change the potential of infection. Dr. Fauci came out many months ago and said, we can't stop the spread. And that was a true statement, because every human being at some point in time has an opportunity to interact with virtually every virus that covers the planet. So stopping the spread was an unrealistic goal, and that was stated. The intent at that time was to slow the spread so that we didn't have a spike, thereby potentially overwhelming our healthcare system. Also a reasonable request, because we didn't know what the burden was going to be. Well, time has elapsed, and now we know what the burden's going to be, and it's not. You're actually seeing most hospitals in the United States requiring furloughs of their medical staff and nursing staff because there are no patients there. We're seeing the medevac facilities that had been put up taken down without seeing a single patient. We're seeing some of the military ships that had been pulled into harbor to assist leave because they only saw a handful of patients. So either we were extremely successful in our sheltering in place, or the virus was far less lethal than we thought it to be. And that latter portion is what has actually turned out to be the fact. Something that we were initially told would kill 1.5 million of us now has been taken down about 50 times that. We now see the lethality of this virus is in the neighborhood of 99.7% survivable, which means you got 0.3% of the population that's going to succumb to this, and those individuals, for reasons that I'm going to state in just a second, and I've already shared with you, a lot of it's metabolic syndrome and immune compromise, those ones are going to be compromised no matter what they're exposed to. So if I've got the same potential of, or actually, I've got better odds of dying on my way to work in an automobile accident than I do of this infection, why on earth would I continue to impose social distancing, face masks, and isolation? Because all three of those things actually foster a reduction in your own immune competency. All along I've been stating that we need to be self-sufficient and make sure that we're managing what our immune system can do regardless of what you're exposed to. And I will double down on that right now, because I've got on my screen here, and I'll make sure that these are tagged in this video, studies on wearing cloth face masks. Because people ask me, why aren't you wearing a face mask? And I say, because it increases your probable risk of self-infection by 13-fold. In a surgical setting or in a medical setting where the doctor or the nurse or the medical worker has a potential risk of somebody coughing or sneezing or releasing other bodily fluids into their face, yes, a mask and a face shield is totally appropriate. But for healthy people, the results are in, folks. You don't put a face mask on healthy people. If an individual is sick and they're coughing and sneezing, yes, reduce the spread of large droplets, but you're not going to change aerosolized viruses with a face mask. And if you wear it continuously, you're actually reducing your own O2 saturation and perfusion, increasing your own risk of self-infection due to the incubation of particle matter on the inside of the mask. And this study was actually really fascinating, looking at people who are coughing and sneezing, because it shows that it actually wraps around and you get more matter on the outside. And then if you happen to touch that, well, now you're spreading that. Take it one step further. You see some of the government entities telling us to stay away from the sand, get off the beach, don't get in the water, stay away from one another. Well, people, that's where we get our microbiome from, and our microbiome is where we get a large chunk of our immune system response. We need to be in the dirt, we need to be in the sand, we need to get the sun on us, we need to get in the water, we need to touch one another, we need to be around people, because it's this interchange of bacteria that makes our immune system stronger. So please turn off the news, because they're hell-bent on getting people to wait for a vaccine for an RNA-based entity. Viruses of this type will continually mutate. That's why the flu vaccine has such a poor record of success. You know, you've got 20 to 35% success with that in terms of training somebody's immune system, because every year it's a roll of the dice. Did we pick the right strains of flu that are going to come to your neighborhood? Nobody knows. It's always a roll of the dice. And there's a lot of speculation that the reason that Italians got hit a little bit harder is because of an aged population that just received a new 4-valent flu vaccine that hadn't been tested on anybody, thereby potentially compromising their immune system further. You got to question these things. So to say that you're going to get a vaccine made for this virus is fallacious at best. It's not going to happen, because it's going to continually mutate, and you're already seeing that in the news. Take responsibility for your own well-being. Don't expect anyone from the government to help you. Don't expect your doctor to reach out to you and tell you to do something, because the industry really isn't designed for that. It's pharmaceutically driven, and it really pushes people off into a space of fear and questioning of what's going to happen to me. But if you know that you've done what you can do to reinforce your own immune system, and then you look at the statistics, you should be able to comfort that space between your ears and say, I'm just fine, and I'm going to be just fine. So eat real food. Stop putting in empty carbohydrates. Get away from those carbs that keep our insulin high. It's insulin insensitivity that is really a major killer here in the United States. It keeps all of our immune systems suppressed. Keep on top of the basic nutrition that I've taught. Stay hydrated and well mineralized. Get outside, engage in soil-based activities so you're grounded and you're introducing a healthy microbiome into your life, and be with people. We need each other in so many different ways. We need each other's microbiome. We need each other's sociality. We need each other's love. We need communication. These are just basic human needs, and isolation is the antithesis of that. So I know that if we do these things, we will be well and successful and happy, and we'll be able to forage through any of the garbage that's thrown at us. But when I see people wearing masks, riding their bike down the street, or driving in a car by themselves, I'm sad for them, because I realize that they must be really scared inside. And when you're scared, that little voice can't talk to you. You lose your own inner guide, and you start relying on sources that have forced that voice out of their head a long time ago. So don't listen to that. Embrace what you know to be true, and if you have questions, please look at actual research rather than stuff that the media is putting out and spinning and putting new faces on, because we can all be well, and we will be well if we allow ourselves to. Have a great day.